Hello everyone! Today we'll be talking about exoskeletons. So what are exoskeletons? Exoskeletons are wearable devices which can help people to perform various tasks, including walking, stairs, sit to stand, and carrying objects. They are used in a variety of populations and health conditions, including things such as stroke, spinal cord injury, cerebral palsy, and other neurological conditions. They are available for both the upper and the lower extremity, and exoskeletons have become increasingly more common in recent years, and research is continuously being done in this field. So this is just a quick video of a gentleman using an exoskeleton. So we'll see him briefly go through a range of motion, walking on the treadmill, and walking up the stairs. So for this presentation, we will be focusing on the lower extremity exoskeleton. So lower extremity exoskeletons are primarily used for gait rehabilitation. There are two main types of lower extremity exoskeletons, and they are the treadmill-based gait rehabilitation exoskeleton and the exoskeleton for overground gait training. Research has shown that the Hall, the Tibian bionic technologies, and the Exo devices were safe to use in controlled environments with the assistance of an expert, such as a physiotherapist who has been trained in exoskeleton rehabilitation. Other common exoskeletons include the Rewalk, the Vanderbilt, Rex Bionics, and the Indigo. So where do exoskeletons fit into physiotherapy? They are primarily being used in clinical settings as an adjunct to conventional rehabilitation. Gait training using an exoskeleton is appropriate and effective across a wide range of neurological disorders. Using an exoskeleton device often requires 2 or more people to assist during the initial stages of gait training. And initially, the treatment times are increased, which unfortunately decreases the amount of time the physiotherapist has to spend with other patients. So looking at the pros and the cons of using a lower extremity exoskeleton, starting with the benefits. There is increased independent ambulation post-training, so 76% of patients studied with spinal cord injury were able to ambulate using the exoskeleton without assistance following a gait training program. However, other studies have stated that under FDA regulations, exoskeletons can only be used in the home if there is a companion present, so things such as donning and doffing the exoskeleton do require a second person. In terms of safety and endurance, using a powered exoskeleton allows patients to ambulate safely for prolonged periods of time, which they would otherwise be unable to do. Using the exoskeleton for longer periods of time has been shown to yield health benefits, including improvements in muscle spasticity. Other health benefits include increased muscular fitness, decreased bone mineral density loss, improved circulatory response, and countering the health risks that are associated with prolonged sitting. Using an exoskeleton allows for repetitive therapy with high intensity and can also help to reduce the time the therapist spends in an ergonomically bad position during gait training. So with these benefits, there are some drawbacks. So there does appear to be an increased risk of falls and risk of bone fracture in this population. However, the occurrence rate of fall during training sessions is 4.4%, which we believe to be quite low, and these falls were usually associated with programming errors in the exoskeleton. And the risk of bone fracture during the training programs was reported at 3.4%, and these generally occurred at the distal tibia or the calcaneus. There is a high cost of individual production, so the cost of a lower extremity exoskeleton can range from $50,000 to $150,000 US, and can be upwards of $750,000 for an entire body weight support treadmill training system, similar to the one shown in the previous video. And these costs are not always covered by private or public insurances. Some units weigh as little as 26 pounds, where others can weigh up to 100 pounds. The weight of the unit may be a major limitation when looking at home-based or community use, as it becomes difficult to assemble and transport the device. It may be extremely physically demanding for both the patient and the caretaker to lift, push, or pull the unit compared to a lightweight wheelchair. Some units require the use of upper extremity supports for balance and to prevent falls. Generally speaking, there is a trade-off between weight of the device and the ability to be hands-free. Movement other than walking in a straight line, such as sidestepping or stepping backwards, may be difficult or even impossible. The speed of the device ranges from 0.2 to 0.7 meters per second, which impedes the individual's ability to navigate in the community, as these speeds would not be fast enough to safely cross a standard crosswalk, and the battery life might also affect community ambulation. Ambulation may also be difficult for those who have a lower extremity exoskeleton, as they are not adequate to ambulate over non-ideal surfaces, such as mud, rocks, pebbles, snow, or rain. And there are currently no standard measures or guidelines for therapy. Some farther considerations and contraindications include the physical interface between the human and the exoskeleton is crucial to provide support and avoid injuries. Each manufacturer varies in their inclusion and exclusion criteria, but most can only be used by people in a specific height and weight range, generally under 220 pounds and between 4 foot 8 inches and 6 foot 4 inches. And they may also have nearly intact range of motion at all joints, little to or no spasticity, good sitting balance, good upper extremity strength and range of motion, and good skin integrity. Patients require complex and specialized training to be able to use an exoskeleton independently at home. No studies reported data on psychological reactions to trauma and the effect on acceptance and the use of the exoskeleton, and studies indicate that more research is required to fully understand the scope and applicability of exoskeletons. So far we've really focused on the researcher and the physiotherapy's perspective on the exoskeleton, so we're going to briefly shift towards the patient perspective. So looking at personal factors, patients feel like they are able to move around more, remain standing, go up and down the stairs, and do feel safe in the exoskeleton. And they also find it very interesting as they are unable to walk any other way. However, it doesn't allow for movements to be initiated naturally, so patients do find that it doesn't help recovery in the long term. Looking at environmental factors, patients do report that it does seem easy to use and they can attain a fast speed. However, in terms of normal walking speed, it is slow. There is jerky movements. They seem heavy, big, and bulky. The battery on the back is a little too big, not aesthetically pleasing, difficult to use in the winter, and difficult to put on independently. And as for the winter, the difficulty to use in the winter, that is a large concern for those living in Canada and northern US. And some life habits that have improved or not by the exoskeleton. So patients have reported that the possibility of traveling, cooking independently, and their general autonomy or independence has increased. However, it is impossible to practice things like sports with 2 crutches. So those who may have been previously highly active or involved in things such as sports are no longer able to do those even with the exoskeleton. So looking at the future of exoskeletons, they are moving towards more of a home-based rehabilitation program. There is such a thing called soft robotics that has been coming out, and it is devices that are made with more flexible materials, which can be individualized and incorporated into clothing or worn under the clothing, which addresses the aesthetic issues mentioned in the previous slide. And they are trying to reduce the weight and the bulkiness of the exoskeleton to improve portability. So the clinical bottom line. Exoskeletons are currently being used in the rehabilitation setting. However, they are not common due to the current cost of the device and the lack of guidelines associated with them. These devices are considered safe and effective, but at present, therapists do not often have much training in this field. New trends in rehabilitation with exoskeletons focus on home use and portability. This will allow individuals to re-engage in everyday activities from a standing position. However, due to the many limitations, further development in exoskeleton technology is required to allow this.